Hello, and welcome to my little lesson on the ethics of care. I'm Daniel Gamble, and today I will be applying these principles to a sector of the food industry that is generally downplayed, which is sort of how the ethics of care are based, anyways. The ethics of care truly boils down to building relationships, not romantic relationships per se, but more like in situations where both the consumer and provider can benefit without anyone being hurt or mucked over. Generally speaking, the most common examples I could find discussing the ethics of care was dealing with doctor patient relationships. Sure, there are doctors that have massive amounts of knowledge in the medical field, but if they don't have empathy towards their patient and truly care about helping them feel better, instead focusing on how much money they can make from a procedure or prescription, they will not be able to build a good relationship with their patients. For example, I would not take my kids to see the army doctors that I did that only give you a huge bottle of 800 milligram ibuprofen and tell you to suck it up, rub some dirt in it, and move on. I would much rather take them to someone that truly cares and wants them to help them feel better. This also goes for the education industry. If the teachers are treating the kids like they're a bunch of buffoons that can never learn any better instead of helping them to learn, there's not much of a point. However, when they take the time to help each student get the help that they truly need, then they're applying the ethics of care in a way that the student can benefit. The teacher can feel good about how they acted, and the school can benefit from having someone that parents want to teach their kids. Say you know about some kids being in a dangerous situation at home that could use some intervention, but you want to do things the legal way and bring in CPS. Would you want a social worker in charge of the case that only cares about closing out work orders? No. We want a social worker that has the best interests of the children in mind. After all, they are our future and they do deserve the best. Now that we've discussed the basic principles and a couple examples, I would like to bring our discussion to something that many of us eat, and that is wheat. Some people truly don't care about what goes into their body, but for the rest of us, we would like for our options to not contain chemicals that are not necessary. Yes, there are organic options, but they are generally a bit more expensive, making them more difficult for many low income families to afford. And truly, I believe that low income families deserve healthy food as well. With this comes my question of whether farmers should be using desiccants such as glyphosate on crops for a faster harvest. What exactly is a desiccant? Well, picture those little packets that come in beef jerky bags that say do not eat, but they're in liquid form being sprayed on crops that we do eat. They are meant to reduce moisture or even completely dry out a product so they can be harvested sooner. Generally, the FDA says there is not enough residue left over after processing to have negative effects in the human body, but this is not always the case. My personal experience on the matter comes from a period where I was going to school for horticulture, and one of my professors, being a farmer himself, was well versed on the chemicals used on crops. He told us that many gluten allergies are falsely labeled, but instead is likely the result of a glyphosate intolerance. Taking this into account, many of us, even a student with a severe gluten allergy, decided to try other options that aren't harvested in this way, and we all noticed a big difference in the way that we felt. And I've also heard similar stories from other people I've talked to about how a lot of wheat is cared for. So, where do the ethics of care come into all of this? Well, it helps when you understand that glyphosate is believed to be a large cause of celiac disease, a spreading problem worldwide, but mostly in North America and Europe where these chemicals are commonly used. It is even said to affect fish from runoff, and we eat those too. So, can you maintain an ethical relationship with your consumers if you are feeding them harmful chemicals? That is debatable. Don't just take my word for it. Please check out some of these resources and see how you feel about whether using glyphosate on crops is using the ethics of care principle or not. Thank you for watching.